Doctor, what to expect when treatment starts?
When a couple comes to us and says that we would like to conceive with you, they have a common misconcept. They feel that if they are asked to go through 1 month of treatment, which is more or less the length of the cycle of the woman's menstrual cycle, every girl will not be able to conceive. It is wrong on the part of the couple to expect conception. I'm sure you realize there is something called as fecundity. Fecundity means the ability to conceive naturally. In the human race, in human beings, God has given us the fecundity of only 10%, which means if a couple comes to us and irrespective of whether we give treatment or not, and if nothing is wrong with them, there is just a 10% chance that that couple will conceive in that given month. Which means out of the 10 couples who came to us, 9 probably will go back not having conceived. If I do a procedure called IUI, it might at the most be increased to 1.5 or 2 times. So the most important lesson that I would like to pass on is that when a couple comes to us, you should not think that you will get a pregnancy in the very first cycle, and you should not feel frustrated because of that, because this is the way nature has built us. We are not lower mammals like rabbits or mice that we will multiply faster than that. Also, it is important to understand this is not an exact science. So we put all the components together and expect it to give us what we want. But sometimes there are intangibles that are not known to us, at least on the present day. So it is important that a couple should have a lot of faith, not in just the science, not in just the doctor, but in themselves. And when this happens, your 3rd or 4th month of treatment, where more or less the same treatment has been given, may yield a result. And yet, probably we also would not know what happened that brought that good result around. So the take-home message for a couple: be patient with yourselves. Expect to discuss the treatment with your doctor, but be prepared to give at least 6 months of time. In some cases, we can't wait those 6 months. Those are different. But in most young couples, a minimum of 6 months are required before we start hitting the panic button.